So then came the Affordable Care Act. It really had incredibly lofty goals. The Affordable Care Act wanted to make sure that, to the extent possible, everyone had health insurance. So to do that, there was a mandate that people have insurance, that employers provide it, and that individuals have insurance. It wanted this insurance to be affordable. It had fewer exclusions. It wanted to make sure that kids in this transitional age of after college, but before they become, excuse the expression, real adults, that they did have access to care. And the law set it up so that they would continue to be eligible to be covered on their parents' insurance until age 26, which is hugely significant for those of us in the mental health world, because that's a time of when a lot of mental health conditions really manifest for the first time. So it's a vulnerable age, and being able to cover people until they reached age 26 was a significant improvement, and also took a lot of worry off from families caring for their kids just out of college, and the kids being able to have reliable access to health care was a relief. And the big, one of the biggest controversies of the Affordable Care Act was that it enabled states to expand Medicaid. It did just skip over one of the really key ones, and that's the essential health benefits. The Affordable Care Act articulated 10 areas of care that needed to be provided in any, they needed to be covered by any insurance plan that would be qualified. So one of these essential health benefits, and this was a huge breakthrough for the people that we care about, was that plans had to cover mental health care and substance use treatment. So that was an incredible breakthrough. And in addition, this also, the essential health benefits are, in a sense, surprising to a lot of us. It would, for those of us who can't remember back before the Affordable Care Act, to think that you would have a health insurance plan and it didn't cover your pregnancy and maternity care seems absurd. To not cover emergency room visits seems absurd. What is health insurance for? So in these years since the Affordable Care Act has been in place, we've been able to accept that these are components of what people who want to be healthy will need. Preventive care is another one that is just really important for us being able to maintain lives of wellness. So these are all, these are key points about the Affordable Care Act. And just the fact that these all got embodied in a piece of legislation that was enacted is incredibly significant and really changed the profile for people of all income levels, of all geographies, in theory, being able to access health care. As we all know, not everything played out the way that it was envisioned. Medicaid expansion was originally planned to be every single state and the District of Columbia. However, through various processes, it was made into an opt-in system for states. This meant that some of the benefits that would have been realized for a uniform system of care and coverage would not come to pass. Nonetheless, it did allow a significant number of people to gain health coverage. And it did so by relaxing some of the eligibility criteria so that, for example, adults of lower income who did not have children could receive coverage, and raise the income limit for families as well, with regard to the federal poverty level and their rate of income. So I don't know that the glass was exactly half full. I'd like to think that it was a bit more than that, because from pre-Affordable Care Act to Affordable Care Act, we really gained a tremendous amount. But it wasn't a miracle. The Affordable Care Act could not achieve uniform coverage. It couldn't allow everyone to keep their existing coverage, which really rankled a lot of people. It didn't affect self-insured plans. It didn't help people of lower income who were living in non-Medicaid expansion states, so that there was this whole population of people that just really did not see any improvement in access to care. And I don't know that we ever expected the Affordable Care Act to eliminate all cost barriers to care, and it didn't. So those are things that, we know that there were things that needed to be improved, but for where it was from the beginning, it was actually doing quite a bit. But people definitely took issue with the Affordable Care Act. There was a philosophical issue about the boundaries of the federal government. So some people believed that the federal government was overstepping and interfering in the market. It did not have a great rollout, so that the first taste of the Affordable Care Act was pretty sour. The marketplaces were not functioning online, so that was a big bump in the road. Some people saw increased premiums. There were definitely rising insurance costs. However, they are rising less quickly than otherwise. Insurers are enjoying smaller profits. And one other thing was that the Affordable Care Act did interfere with the ability of Medicare to negotiate drug prices. So some of these are fair criticisms, and some of them are political viewpoints. And honestly, some of these can never be resolved through the political process until there is just a stronger consensus among the population at large. So the results of the Affordable Care Act. By early 2016, over 17 million people had gained insurance coverage. Medicare had been expanded in 31 states and the District of Columbia, and forgive my typo because I believe it's 134%. The uninsured rate, that is the number of people who do not have health insurance, was at its lowest level and had dropped below 10%. And the price of health care, the rate of rise had slowed. So these are significant benefits that we experienced from the Affordable Care Act. In all, the Affordable Care Act expanded mental health and substance use disorder benefits and the protections of mental health parity to more than 60 million Americans. Prior to the end of 2016, we did also enjoy two acts being adopted. One is the 21st Century Cures Act, and the other is the Comprehensive Addiction and Recovery Act. And to be able to sit and say that there were two significant mental health-related pieces of legislation that became law in a year is, frankly, it's incredible. Only 2% of bills get passed in a congressional session, so that's 2 years. And here we have two mental health and substance use disorders bills that passed. So the 21st Century Cures Act strengthens enforcement of mental health parity, does some things for suicide prevention, looks at patient privacy laws, and the role of families. And one little thing with Medicaid, it's not very little, but it seems little. It used to be that a person couldn't see their primary care provider and mental health provider on the same day, so that has been corrected. The Comprehensive Addiction and Recovery Act is the first major federal addiction legislation in 40 years, and it is a comprehensive effort to address the opioid epidemic, coordinating response among prevention, treatment, recovery, law enforcement, criminal justice, and overdose reversal. So that is really something that we should applaud our fellow advocates for their perseverance in getting these two pieces of legislation through.